I have a special relationship with multiple sclerosis. 20 years ago, I was a neurobehavior fellow at the UCLA Neuropsychiatric Institute. Multiple sclerosis, or MS, was one of the brain diseases that I was learning how to research and treat. One day I woke up and went for an early morning swim, and when I returned to my apartment, I felt an odd, numb and tingling feeling from the waist down. A couple of days later, I'm standing at the X-ray viewer in my neurology clinic looking at an MRI of my own spine. And there was an opaque triangular area inside the cord. My mentor, Jeff Cummings, who has an encyclopedic memory, was listing in outline form all the possible conditions that this could represent. Well, MS was by far the best item on the list, and the only item that would give me more than about a 2-year life expectancy. Later that week, I developed upper body numbness and had an MRI of my brain that showed some punctate contrast-enhancing lesions. That afternoon, there was an empty neurology clinic room that was available. Well, it was available because it was my room. My patients had been rescheduled. Anyways, my cerebral spinal fluid confirmed I had multiple sclerosis. I have now had 2 decades of experience studying all the mainstream treatments for MS and using several of them myself. I also have 2 decades of experience interacting with numerous other individuals who have MS and listening to their claims of alternative medicines that are supposed to help. Guess you could say that I'm an expert at the interface of alternative and mainstream medicine with respect to MS. More recently, cannabis or marijuana was made legal in my state of Colorado, and they claim that it can treat muscle spasms due to MS. Well, since I have muscle spasms due to MS, I thought I should do some research. Turns out, studies indicate that it does work, but it has no greater efficacy than standard medications. There are individuals online who provide testimonials with video evidence that seem to suggest that it can have a dramatic effect. I suspect placebo. There is a link under this video to a 1-minute YouTube clip of one of these individuals. I would bet that cannabis has real physiological antispasm effect. I would also bet that the behavior of consuming cannabis, whether by bong or by joint, has a potent placebo-enhancing effect. In other words, real medicine plus placebo effect equals better outcome. I think this is a theme. It could apply to lots of alternative treatments that are claimed to benefit people with MS. Acupuncture, for example, has long been touted to be a good treatment for MS, but has now been demonstrated by scientific investigation to be a physiologically inert therapy. That means it doesn't do anything. It has also been demonstrated to have a potent placebo effect, because of all the needles and the ancient Chinese stuff and all that. Well, acupuncture is not going to regrow myelin on the nerve cells in my brain. It's also not going to interdict in the process of multiple sclerosis on a molecular level, but, well, it still maybe could if placebo therapy turns out to be able to activate immune-related neurotransmitters that can affect autoimmune disease, but I think that's unlikely. In any case, acupuncture can still help people with MS. It can help us to sleep, have less pain, minimize psychosomatic complaints, maybe even help with depression and anxiety, which often accompany MS. Since there is real brain injury, it would be nice, I think, to grow some new synaptic connections in areas that aren't damaged so that my cognitive impairment would be less. Turns out that science is learning that this might be possible through practicing cognitive activities. I wonder if other non-pharmacologic interventions could improve my emotional health in a similar way. MS makes me emotionally disinhibited and causes me to have anxiety. Some people get depression. I wonder if these things could be improved with the use of alternative medicine on a regular basis. I may be biased in that I have MS and may be susceptible to thinking that treatments will help when they actually won't. The interesting thing is that if I can allow myself to really believe, then I might benefit more from the placebo effect. but I may be too hard-headed to allow this to happen. This is why the placebo effect is more effective with some individuals than with others. Different people have different personalities, and some folks simply follow instructions better than others. I don't follow instructions very well. This is an advantage in that I am less gullible, but this is a disadvantage when it comes to benefiting from the placebo effect. Remember, the placebo effect is about social interaction with a caring authority figure whose direction you are following. If you think you are smarter than everyone else and question anything anyone tells you to do, then you might not be a good placebo responder. I want to emphasize one very important point. There are a lot of charlatans out there, a lot of people selling fake stuff for profit. I mean, alternative medicine is a $1 trillion per year industry. Those that will respond best to the placebo effect will also be the most gullible and can easily be taken advantage of by charlatans. As a major part of what I'm doing, I want to limit or reduce the degree to which people are risking their health with bad advice from alternative medicine. Now, it's kind of a tricky line. The way I do it is to basically just say alternative medicine is okay only if it's inexpensive, non-invasive, there's no deception, no risk of medical harm, or at least direct medical harm, and you understand what it works for and what it does not work for. I mean, it's just terrible when people think that ear candling alone will cure their leukemia, so they don't use standard treatment, which has a 95% rate of total cure. MS is an interesting disorder to study in regards to the integration of alternative and mainstream medicine. It is my opinion that both should be used together, but that care should be taken to avoid undue expense or medical risk, and everybody who has MS should be on a standard MS medicine.